Well, state lawmakers are working to change how much Hoosiers pay for life-saving insulin. It's a problem they say they've heard about far too often and many times after someone has died. Our TV6 reporter Cameron Riddle spoke to an Indiana man who knows that loss all too well.
Indiana lawmakers say the price of insulin is just too high. In fact, it is so high that the patients who need to take it are risking their own lives so they don't have to buy more insulin.
I've been a type 1 diabetic for 44 years. Last year, towards the end of the year, August 25th, I had a 39-year-old son. Keyword being had, because he died because he couldn't afford his insulin.
Harry Rybolt is not a politician or a lobbyist, but his presence is noticed at the State House as he pushes to change the healthcare system that he says killed his son Jeremy, who was rationing his expensive insulin prescription.
So now I'm honestly a pissed off dad who wants things to change. I can't bring him back, but I want to try and save other people.
Rybolt's son Jeremy was paying $167 for a single bottle of insulin more than once a month. Late last year, Jeremy started a new job, but was still rationing his insulin.
He was waiting for insurance to kick in on his new job, and he didn't survive.
Harry Rybolt is now looking to lawmakers to cap the price pharmaceutical companies can charge for the life-saving substance. This year at the Indiana State House, there is a chance that could happen. Senator Eddie Melton has proposed a new law that would cap the price for a 30-day supply of insulin at no more than $50 a month. The bill would also make epinephrine or EpiPen injections free for people under 18. Across the hall, House Representative Robin Shackelford is proposing a $100 cap on a 30-day supply of insulin. Shackelford says the price to stay alive is literally too high.
It's gotten very out of hand. If you still have to pay $300 or $400 after your insurance, that's a steep hill. That's a lot for a lot of people.
Rybolt says simple common sense and human decency will save lives and would have saved his sons.
I know companies have to make a profit, but if you marked it up 4 times, that's $28 for a bottle. Chances are I could afford that to get through.
Working for you in Indianapolis, Cameron Riddle, RTV6.
And Democratic State Representative Robin Shackelford says she plans to attach her proposal to a Republican-backed health care bill as an amendment where it will have a better chance of being passed into law.